in addition to Kardashians, we also have all kinds of women of all age groups who live in Calabasas, just like everywhere else. And all women, fortunately or not, are destined to go to menopause. So this is the condition that universally affects all women who are privileged enough to live long enough. So hormone replacement therapy is one of the modalities that we treat perimenopausal and menopausal states. You have to ascertain how much of a life change and the symptoms that are affecting your quality of life. Hormonal menopause therapy is aimed to replace things that you don't have or no longer make in enough qualities and quantities. So specifically, a gradual decrease of ovarian function results in decreased production of estrogen, testosterone, progesterone, and a bunch of other things. Unlike estrogen, there's another massive producer of testosterone in our body, which is adrenal glands. So there is frequently a disbalance in the quantities of estrogen versus testosterone, which results in the famous symptoms of getting a little annoying hairs here and there. And you have to have an evaluation with your doctor that will consider what are your medical conditions and what are your symptoms and what other medications that you take. What is your family history? The simplest thing for a healthy 50-year-old whose life has become very annoying with her perimenopausal symptoms, if she has no significant family history, she has no own medical problems, or has mild health issues that are under control, such as mild hypertension, for example, can be treated with a combination of hormonal therapy that should include at least estrogen and progesterone. If the woman's uterus is still in place, a consideration should be given to testosterone replacement too, because exercise tolerance, joint pains, a degree of depression, all of those related to testosterone insufficiency or underproduction. If a person has no uterus, a consideration should be given to the fact that progesterone is no longer required to support the overall health. So overall approach to therapy should be very individual for each woman in question. In addition to hormone replacement therapy, there are also other modalities of treatment that may be helpful to this patient. So there are things that can be used for women who cannot, for the health, because of the health issues, to use hormone replacement therapy. There are medications such as beta blockers, gabapentin, that are designed for joint pain, for control of the hot flushes and the night sweats, and can be used either on their own or as an adjunct to hormone replacement therapy to help with the symptoms. People who have emotional ability as a primary symptom or a most important symptoms can and should be considered for treatment with SSRIs, which is a group of medications designed for control of depression and anxiety. And sometimes a simple patch that you can get from your friendly neighborhood pharmacy for a very reasonable copay will do just as good of a job in hormone replacement therapy as it may be an individually based compounded medication. Notable exception would be testosterone. Testosterone for women is only available in a compounded form for women. It is not available in the general pharmaceutical distribution. Those are only available for men. There are availability of online sources for hormone replacement therapy as well.